Okay, how do these vaccines work? This is step one prep. 30-year-old nurse, needle stick injury. She's caring for somebody with chronic Hep B. She's asymptomatic, and she has completed the vaccine series. For the next 6 months, she undergoes routine testing, and she's still negative. How is she protected? So the HBV vaccine contains recombinant HBsAg, which is a non-infectious viral protein. It's not not a live virus. It stimulates the immune system to produce anti-HBs antibodies. So those antibodies are produced, and they bind whenever they find HBsAg on viral particles in the bloodstream floating around. This prevents HBV from ever attaching and entering the hepatocytes. So it completely blocks the infection before it starts. HBV vaccine is wonderful. So how do you distinguish the immunized versus the naturally recovered individuals? Well, after exposure to HBV, two groups of individuals will have anti-HBs antibodies. The vaccinated only have the anti-HBs antibodies, and the previously infected individuals have both the anti-HBs and the anti-HBC antibodies because they were exposed to the actual virus. And in this case, the nurse is vaccinated. She only has the anti-HBs antibodies. Okay, so other examples: activation of the cytotoxic CD8 T cells. That is wrong because the vaccine prevents the infection from ever happening. So you won't actually have to worry about that cell-mediated CD8 T cell clearing active infections because it's not even going to get into the hepatocyte in the first place. Inhibition of viral protein replication by reverse transcriptase blockade. That's wrong because that's the mechanism of nucleoside reverse transcriptase inhibitors, like tenofovir and decavir. It's used to treat chronic HBV. So, nope. That's like if you've got the chronic HBV. Induction of innate immune responses via the interferon signaling. So HBV evades the innate immune responses. So interferon alpha is used in treatment, but the vaccine works by antibody-mediated prevention of the entry, not innate. So there's nothing innate about this. Disruption of the viral assembly by blocking NS5A. That's wrong because this would be like ledipasvir, and that's used to treat Hep C, disrupting the viral assembly, not Hep B. So you don't have any viral assembly stuff going on. You just have antibodies which latch on to HBsAg when they come, and they prevent entry at all into the hepatocytes. So naturally recovered individuals will have anti-HBs and anti-HBC antibodies, and the vaccine does not do any cytotoxic T cell stuff, doesn't block replication or interfere with viral assembly. So there we go. If this is helpful, like and subscribe.